I'm a psychiatrist. Ask me anything about work and depression. Hi, redditors. My name is Dr. Sagaperik. I'm a professor of psychiatry at the University of Michigan and University of Toronto, and the education chair for CANMAT, Canadian Network for Mood and Anxiety Treatments. As a psychiatrist, much of my focus is geared towards helping people manage depression while maintaining the routine and responsibilities of work. This includes how to practice coping strategies, what to communicate to others, and requesting workplace accommodations or sick leave. The situation we face with COVID-19 increases our susceptibility to depression and the pressure to manage our responsibilities at work. Do you have questions about work-related depression? I invite you to AMA NB with professional organizations like CANMAT www.canmat.org and Canbind www.canbind.ca. We are able to participate in shaping policies and regulations suited to address mental health in the workplace. Are you a Freudian or a Jungian, ECT? Psychiatrists are medical doctors using a blend of neuroscience, medications, and psychotherapy to help patients. Freud and Jung were major thinkers who contributed to the development of psychotherapy, but their therapies are not a significant factor in the treatment of major mental health problems. What strategies would you suggest to create a mentally healthy working environment? Key aspects of a healthy workplace include the ability to be heard and respected, to allow people to be open about their concerns, and to schedule self-care into their daily routine. This means taking lunch breaks and other breaks, never contributing to office gossip, and allowing discussion of difficult issues, rather than avoiding them. Do you suffer from an illness yourself? If so, how is your patient experiencing? When are people with depression not able to work vs when does working help? Making the decision to work when you have marked depression or anxiety has to take into account severity, safety, and the nature of the work. For many people with mild depression, the act of going to work provides structure to the day, familiar interactions with work colleagues, and some distraction from negative thinking. If the work has safety issues, such as operating dangerous equipment, or carefully measuring medications etc. to give people, then someone should review with their doctor about whether to take time off, and if safety is jeopardized. People who are active in work, such as doing labor outside like gardening, would often benefit from going to work as the exercise helps fight depression. Can I have stress without me knowing it? Few weeks back my hand starts shivering, and my heart beating very fast and hard at 133 BPM. I went for full body checkup and everything came out fine, but my hand still shiver and heart still beating relatively quick. After a week I'm back to normal. I don't know if it's stress that caused the problem, but there is some issue in my mind that I'm worried about, but it's not that big of a worry too. One relatively common condition that causes a very rapid increase in heart rate and anxiety and often dizziness is POTS syndrome, where there is a problem with how the nerves and blood vessels interact. People can have sudden anxiety with that. Looking for that is part of a checkup. Panic attacks can also resemble that, so figuring out whether it is anxiety or part of a cardiac condition is important, and may need a couple of visits to sort out. POTS syndrome generally shows as well with low blood pressure and easily becoming dizzy when you change posture, such as sitting up from bed. At what point did you think to yourself that the romantic side of psychology ends pretty quickly, if you ever thought that? And what would you say is the hardest part of your job? It's always a privilege as a physician to be trusted by patients and to provide help. The worst part of the job is dealing with electronic medical records, which takes away time from talking with people. I was diagnosed with ADHD, and I was prescribed both medication and therapy. Will it affect me if I don't take medication? If you were carefully assessed by a health professional and advised to take both medications and therapy, it seems reasonable to try both and continue to evaluate if the treatment works. You should discuss with your prescriber if you wish to try the psychotherapy alone first. Many people with milder problems try one treatment first and then only add a second treatment if they need it. What are symptoms of depression? I know that sounds silly, but I'm serious. A good place to review the symptoms of depression and related problems, along with tips on how to manage symptoms, is the Michigan Depression Toolkit. Check it out. Thank you. Do you have advice about being open at work about a mental illness? You have to careful and thoughtful about what to disclose and to whom. Also, you have to decide if you want to combat stigma about mental health. Here is a resource which explains how to be a stigma fighter. I've heard it takes 10 to 12 years to become a fully licensed psychiatrist. How long did it take you? And do you think being a psychiatrist is worth all the schooling? While there are some differences between countries, usually a psychiatrist completes 4 years of undergraduate degree, such as a BA, 4 years for medical school, MD, and 5 years of specialty training in psychiatry, board certification in the US, also shown as FRCP in many countries. If you choose to be a research psychiatrist, there is at least 2 more years of training. As they say, it's the journey, not just the destination. Psychiatry is a wonderful opportunity to bridge science, medicine, humanity, and the arts in the service of patient care and social progress. On surveys, psychiatrists are among the happiest of medical specialists. I'm not sure when it's time to throw in the towel on my artistic career pursuit, because the job that makes me money, waiting tables, brings me very little joy or satisfaction. I find this decision to be extremely challenging. It feels huge. Is there a resource or a person you can refer me to be able to discuss or seek advice for this issue? The current state of our world has made this even more prominent. Because both of these industries are temporarily shut down, and I now have at least a month of free time where I could be starting to build a career in something else. It's helpful to get input from many sources. Here is one article. Although it's from the United Kingdom, I find it a very nice summary of the key issues. Consider talking to a therapist as well to sort out what frustrates you and clarify your thinking. Ask friends what they think you are good at, and then compile all this information from others with your own reflection on what you want to do. Then, try something, like shopping for clothes. It's important to try several different things before settling on one. Hey lovely bastards, like and subscribe if you want to see more.